Assalamu alaikum. Our talk today, as it seems, is about COVID-19 and the new world of public health. And what I want to start with is whether we want it or not, most of us have received some sort of crash course in public health with the coronavirus pandemic. As we know, public health has always encompassed health education, prevention, and addressing infectious diseases as well, with an overarching goal of improving health outcomes. But it's so much more. Today, we live in indeterminate times as coronavirus occupies every thought and action in our mind. Now is the time, as I think, to recognize the imperative role public health plays, not only in fighting this pandemic, but even more also in calling attention to the enormous range of topic public health touches to improve health outcomes. So we can freely say that public health is everything. As we see what are affecting our health, we have many things that are affecting our health, either our individual causes like our age, gender, constitutional factors, how we are living, what lifestyles are we adopting in living, so we call it individual lifestyle factors. Definitely social and community networks are affecting us. Lastly, general socio-economic, cultural, and environmental conditions like the agriculture, food, and agriculture and food we eat, our education, our work, living and working conditions, unemployment, water, sanitation, healthcare services, and housing. So now public health interventions address or must be addressing all conditions in which people are born, grow, work, live, our individual causes or our individual factors like our age, our gender, and the wider set of forces and systems shaping daily life. This is very important in determining our health. So, for example, when any one of us have been told to eat some nutritious diet to stay well and healthy, but unlikely we cannot reach this access. This is a public health problem. So ensuring the access to public health is very important in every part and in every corner of our life, where we live, what we eat, are we working or not, what about our healthy practice, do we exercising, are we exercising, or are we experiencing lazy life in front of TV and eating a lot of Pepsi? So addressing public health requires each of us to think about the physical and social environment in which we live, the food we eat. Also talking about the chronic diseases, it's very important, just like heart diseases, diabetes, obesity, for example, have increased risk of severe illness. For example, also mental health and the environment in which we live, what we eat, what we drink, and so on. This is called the concept of holistic approach to human health. Again, this way of thinking is called holistic approach to human health. So we can say freely that public health is what we do together as a society to ensure the conditions in which everyone can be healthy, everyone matters, and everything, every very minute point is very important. So everything matters. So public health promotes and protects the health of people and the communities where we live, where we learn, what we work or not working, and even play, even leisure times. So public health is everything again, to make it more sure. So turning to or stepping forward to COVID-19, we can say that COVID-19 pandemic is more than a health crisis. It's not just a matter of health effects. COVID-19 is a crisis like no other crisis the world has been facing in recent decades. In what terms? In terms of its potential economic and social impacts. So we can say that its long-term economic and societal effects may well outweigh its initial public health impact. Outweigh here, or it means it exceeds the public health impact. So it's therefore essential that responses must be socially sensitive and attuned or suitable to mitigating these secondary effects. Here, not health effects only, but societal effects and social effects, or economic, sorry, societal effects and economic effects. Also, we cannot forget or disdain the long-term impact the disease will have on mental health, for example, and of individuals and communities. A lot of people are suffering after getting the disease, even without suffering of the disease. Most of people now are suffering fear, isolation, loneliness, depression, and anxiety that can weigh on the human spirit and hope for a healthy future. People now are feeling greatly threatened. Anyhow, we've been facing now eerie effects of the faceless disease, as I call it. I call it a disease without catalog. Considering this point aside, with the rampant ignorance existing among huge sector of our communities, we detect that we've been living in a scourge and disaster. So we have two problems. The first one, we are facing a problem like we never faced it before. It has no catalog, it has no face, it has no characteristic features. Everything is every day is changing with a new face. Aside of this point, we have another problem is that we are living in an ignorance and in rumors, a lot of rumors. Okay, when we start to touch the public health and crossing with the COVID-19, we know that COVID-19 knocks out the poor hardest. Because the measures taken to contain COVID-19 is in what's seen is are affecting more commonly households in many ways, including a lot of points like job loss, like loss of remittances. Remittances here means wages. Uh, Also, the higher prices we are facing now in the market, rationing of food and other basic goods, and disruptions to healthcare services and education. While the impacts will be felt by most households almost immediately, they will likely be deeper and longer lasting among the poor, who are more vulnerable for several reasons. Like what? Uh, Suppose we are living in rural areas. The rural households tend to depend more on domestic remittances from urban sources. Money sources are coming from urban sources. Economic shutdowns in urban areas definitely will hurt rural too. So, suppose our sources in rural areas are coming from urban areas, where that urban areas are already suffering from shutdowns, so it definitely will affect the rural areas. Population living in rural areas also are living in congested settlements, so no way for adequate social spacing, no way to speak about the 2 meters distance in between every two persons, because there's a lack of space, there's a lack of knowledge. Okay, so also in speaking about the population or people living in rural areas, they already are suffering of limited access to health services. Limited access of health services means here limited services at all levels, for limited hospitals, limited health centers, limited staff. Even with the limited access to health services, there is a low quality services which would significantly increase the risk of being infected by the contagion. So where they live, as an example of holistic approach to public health, the first point is where they live. Living in poor areas is a vicious circle affecting more hardest or more harder the poor population. The second important point, speaking about the poor and saying that COVID-19 is knocking out the poor hardest, aside from living in poor areas with low services, with low income, with low knowledge. Second point is where they work. Usually, the poor people living in poor areas are working in agriculture and informal works, and even in self-employment, like in micro and family enterprises in between different families. They are making certain small enterprise. This is self-employment with no insurance coverage, with no definite health services. So, those employed in the informal service sector in such urban areas are definitely, with no question, are more likely to have a greater risk of, in comparison with other people in regular working. I speak here about those who have insurance, who have definite occupational health services. Those poor people with informal working with or with self-employment definitely are at more risk, and they are usually bearing the most severe initial impact. Even in addition, many of the vulnerable non-poor who are increasingly employed in low-class economy, we usually say it gig economy. Gig economy here means low-class or low-standard economy. Those people, particularly in the middle-income countries, will also be at risk of slipping to be into poverty. They are slipping from a moderate to low social classes, from moderate poverty to deep poverty. Those engaged in agriculture may be, as we said before, those engaged in agriculture may be able to cope at least initially, at least at the start, with potential disruption to food supplies, for example, or price spikes. But after that, are likely to be affected by a decline in demand in urban areas. Again, the stats of urban areas are usually reflecting on the rural areas. What about third point about the poor communities? So ultimately, we can say that rural communities are facing a unique set of challenges in the face of COVID-19 pandemic. It's facing a group of challenges in the face of COVID-19. We can brief it collectively as they are often areas already affected by, as we said before, high levels of poverty, lower levels of access to quality health care, lower levels of health literacy, and social stigma. Many elements contribute to these problems, including congestion of population in such poor areas, economic stagnation and economic shutdown everywhere across the world, shortage of physical and other healthcare professionals, disproportionate number of older, poor, and underinsured residents. We are repeating now to make it more clear, as well as high rates of chronic diseases. Okay. Uh, from the time when COVID-19 outbreak lingers to place a burden on hospitals, the services becomes more bad and more bad. Alarm and worry are growing that many hospitals, in particular rural hospitals, have shortage in supplies, have shortage in economic sources, and may not have financial reserves to remain fiscally viable. Most of hospitals, most of health centers in such rural areas, as we have said before, are mainly depending on what they are receiving from urban areas that are already suffering from economic problems. So the economic problems, as we said before, in urban areas have been reflected on rural areas that are already suffering from a lot of problems. Uh, Again, how strongly health services can be affected in rural areas? Many factors are affecting because, first of all, only tight budgets. We have explained many times before that most of rural health services are receiving their supplies from urban areas who are already suffering from a lot of economic problems. So only tight budgets may be probably available to most of the rural hospitals. Since rural households tend to depend more on domestic remittances from urban sources, we said it many times, economic shutdown in urban areas definitely will hurt them too. So shortage in medical and paramedical staff with probable poor experiences. The kinds of technological advancements which are not available in most of rural areas, and almost the rural areas are in need of remote health services with high technology advancements from urban areas. All of those factors have been reflected on rural health services. Second, the closure of rural healthcare facilities or discontinuation of services can negatively affect access to healthcare in a rural community. Yes, people in rural areas who get sick with COVID-19 have, we said it many times before, have fewer hospitals to treat them. Compared with urban hospitals, the rural hospitals, definitely, as all of us know, are smaller, um, have higher proportion of primary care physicians, and a lower proportion of board certified physicians. I mean here specialists or consultants, have fewer intensive care beds, intensive care units, and usually are less likely to have contracts with health maintenance organizations and preferred provider organization. I mean here lack of insurance. Uh, Third point, people living in rural areas are at increased risk of COVID-19. They also facing significant barriers to access care, including provider shortage, recent closure of rural hospitals, for example, long travel from their homes to the available health services facilities. Uh, we can say also that local rural healthcare systems are fragile. When one facility closes or provider leaves, it can affect definitely the care of such areas. Furthermore, when a hospital closes, access to non-hospital care can also decline because many specialists cluster around hospitals more in urban areas. Now the big question, why 90% of developing world is vulnerable to COVID-19? It's very weird. Some communities, we can say that some communities are more vulnerable than others. They have a limited ability to mitigate, to treat, and to delay transmission of pandemic diseases and to reduce its economic and social impacts. I can say it's an innate character. Why nobody can know. So again, some communities are more vulnerable than others. Uh, Finally, to define what community is more vulnerable than other community, there was a tool that has been invented by certain scientific foundation in USA, which is called Sergio Foundation. It was invented by 2020. This tool is called CCVI, COVID-19 Community Vulnerability Index. Uh, the function of such tool or such index to define or to identify the communities which are more vulnerable than other communities. It provides vulnerability score for every state, for every country, for every location in the USA, but it has been used globally now, and it was modified according to each community. Such scores are usually reflecting the characteristics of an area that might make it more vulnerable than other communities. So, uh, the CCVI is a tool that has been used to drive precision policy by the end. It defines what community is more vulnerable and it gives suggestion of what policy that may be probable or convenient to such community to defeat COVID-19. Uh, this index usually captures vulnerability across many points, across health, across social, across economic, because we have said before that COVID-19 is not just only a health problem, it might be social or economic. So the COVID-19 Community Vulnerability Index has to go across the health status, social status, economic status, or dimensions that have been felt by every community and make it more vulnerable than other communities. It's clear, and it's not covertly, that vulnerable populations definitely have experienced more cases and deaths, higher unemployment, and lack of access to critical support, such as, for example, testing sites and, for example, making PCR. So the precision policies targeting the vulnerable population suggested by such tool need to be designed and enacted to decrease the gap in negative consequences experienced in this and even in the future pandemic. And the COVID-19 Community Vulnerability Index, as we said before, can be used as a tool to highlight where and why these inequalities occur, inequalities in between urban areas and rural areas. So again, COVID-19 Community Vulnerable Index is a tool that captures the health, the social, the economic conditions that lie behind more vulnerability of such communities to COVID-19 in comparison with other communities. Uh, CCVI score is based on 40 variables, including health, as I said before, including health, social, and economic. For example, the share of large population in poverty, a community in which all the people are poor, they are sharing poverty. The share who have minority stats, like, for example, Negroes, for example, in other communities. Uh, like what also in minority, like females, for example, in some communities, but in our community, females are more than males. Anyhow, the share of households experiencing overcrowding. Most of the poor areas are sharing overcrowding, as we said before. For example, epidemiological factors that might make a population more vulnerable to COVID-19. For example, the chronic diseases, cardiovascular, diabetes, hypertension. Also, again, we speak about health, we speak about social, we speak about economic. So, healthcare system factors, including the number of intensive care, we said that before, overall population density, and the share of population in high risk industries. The score usually from 0 to 1, with higher scores indicating greater vulnerability. As we said before, it captures greater risk of health and economic impact. It has enjoyed widespread use in response planning. Usually, it was invented in USA, and now it's enjoying widespread use along or across the world. The score generated can be used to designate the level of vulnerability, as we said before, as a conclusion. For example, here is the COVID-19 Community Vulnerability Index for Africa. It identifies the factors that lie behind high vulnerability of COVID-19 among African population. For example, many themes have been used: socioeconomic vulnerability, population density, access to housing and transportation, access to health services, epidemiological factors like non-communicable or communicable diseases, chronic diseases, health services applied in such community, fragility of such community, and age. Is it a community of old people or very young people? Is it community of more commonly females or males? So it will help governments, donors, non-governmental organizations, and advocacy groups. Such index also help researchers and others develop more effective data-driven responses to the pandemic. So finally, CCVI is not designed to predict which individuals will become infected, but here I'm speaking about communities. It can provide information about the anticipated negative impact at the community level, not at a personal level. Second, it's useful in developing a community risk profile for SARS-CoV-2 infection that can be used to target and tailor control efforts that are or that must be suitable or convenient to such community only, which means we cannot apply it for another communities because the CCVI depends on each community characters. Lastly, information can help decision makers target resources where they are most needed. Ultimately, what I want to say is no ideal or no perfect solution for defeating COVID-19 that can be applied all over the world, because as we said before, that COVID-19 has different impacts based on different communities, and as we have said before, that poor communities are hardly affected in comparison with other communities based on its specific own characters, either health, social, or economic, which can be defined by the tool, which is CCVI, that can define what factors behind more vulnerability across certain communities in comparison with other communities. Ultimately, there are no magic bullets, but the promise of science and innovation is excellent. We cannot expect what's going tomorrow and after tomorrow. Science is inflating every day in innovation regarding many aspects, especially COVID-19 now, because it's the big cornerstone that has been facing the world. So we must continue our efforts to improve all aspects of public health to improve our odds of a healthy future together. Ultimately, I hope that the presentation was not boring to you, but I believe it's very simple, and I'm ready for any question at any time, as you know. Uh, Thank you for all.